Today, we're going to be doing movements that are going to condition the pelvic floor, bring blood flow, awareness, a little strength, a little flexibility. I always like to point out the pelvic floor because it's a little bit confusing. Sorry, the skeleton's getting a bit whited out from the light. There we go. So here we have this basin of the pelvis with this open space, and this open space is much bigger than our anus or our genital openings here, and it's netted. Instead of holding us together with bone, there's a netting of musculature that's figure eights, and it's crisscrosses, and it's every which way, every direction. And it's not unlike how we have all of these organs in this space that isn't in a cage, like the lungs have a rib cage. These guys are just free. And it's one of the purposes of the abdominal and the back muscles is to contain you and also have the flexibility so that when you breathe, they can expand. Because when you breathe, your diaphragm drops down, your organs drop down. So we need to expand out and we need to expand down through the pelvic floor. And then when we exhale, the diaphragm lifts, the belly will condense gently and it will condense the pelvic floor up with it. Okay, so that's just a little bit of a view. We're looking a lot at, here's the back of the pelvis, our sitting bones. So when we're sitting down, sorry, this white, the sitting bones here that we feel on the floor are the outer border of our pelvis. And then we have a tailbone and a pubic bone. So in a way, we've got a diamond here. So I might reference your diamond of bones. And that's what I'm talking about. Okay, put her back. Let's get moving. We're going to start with breathing because breath is the first step to starting to open up the pelvic floor. I want you just to relax and close your eyes. And we're going to try to breathe primarily through the nose today. I will remind you throughout, if your nose is stuffy and you have trouble breathing through the nose, just try to anyways for today. And maybe you have to breathe a little slower, a little shallower. But breathing through the nose is something like if you don't use it, you'll lose it. And we want to breathe through our nose because it allows for a more natural expansion inside the lung, the diaphragm, more involvement from the belly, the pelvic floor. Okay, it's just the way we're intended to breathe. So feeling that breath come in through the nose, we know that the diaphragm drops to allow expansion in the ribs. The belly starts to expand too. Notice that. And then as you exhale, you may not feel the diaphragm lift. Okay, you don't really feel that, but you could feel that your belly condenses a little. So just be aware of that as you continue to inhale and exhale slowly through the nose, feeling the belly expand on the inhale and feeling the belly condense on the exhale. And I want you to think about that pelvic basin, that hole, right, that you're sitting on, basically between your sitting bones, your pubic bone and your tailbone. And I wonder if as you inhale, you feel your belly expand, could you allow a sensation of expansion through the pelvic belly, through your floor? And then as you exhale, there's a sense of condensing coming in and up from the pelvic floor. Breathing in to expand your floor. Breathing out, it's like a suction coming up from the floor. The cue that is kind of weird, but works for people, is if you imagined that your mouth was down there and you had a straw and you were drinking a smoothie, a thick smoothie. Your exhale is like you trying to suck that straw, pull that smoothie through the straw up into your belly. And it's just kind of maybe even a little, there's a berry in the straw. So it's not really pulling through, but just keep pulling up as if it's going to any moment. Then as you inhale, relax. Okay, there's a little expansion happening as well. And as you're sucking up that straw, as you're sucking up that smoothie from your floor mouth, I want you to, sorry, sometimes some of the key things that come out of my mouth, from your floor mouth, that made me lose, oh, don't squeeze your anus, okay? So as you're breathing in and pulling up, notice if that makes you squeeze your anus and your sitting bones in. Don't do that. Try to relax that. It's subtler than that. It's more intricate. You might not even perceive it if this is the first time that you're trying this, okay? So just be experiencing this for what it is. Imagine in your mind what it could feel like, and just continue breathing deeply. And we're gonna add a little rib cage movement. I want you to inhale, lift your heart up. I want you to exhale, round back. Inhale, lift your heart. Exhale, round back. Take an inhale, don't move. Exhale, lift your heart. Inhale, stretch back. Exhale, lift your heart. Inhale, stretch back. Place a hand on the floor. You're going to inhale as you stretch an arm over. Exhale down, other side. Inhale, stretch an arm over. And it's more than the arm going over, it's the rib cage stretching, so we can get some movement in the diaphragm through the sides of the ribs. One more each side. When people like postnatal, or maybe they have some sort of situation that's really tough on their pelvic floor, and they go to pelvic floor physical therapy, a lot of it is breathing. Breathing is how we engage and repair the pelvic floor. So if I'm cueing you throughout this class and you don't know what I'm saying or what to feel, focus on the breathing cues and know that you're getting what you need for today. Okay, now we're here on our sitting bones. We're going to move our heart around in the rib cage. Let your heart move to the front of the ribs, the side, along the back, and the other side. How about you inhale the whole time you do one rotation? Long inhale. And one exhale through a whole rotation. Through your nose still, breathing in and out. Let's reverse. And exhale. One more like that. And let's come on to hands and knees. All right, lift your tail gently. All right, you can look forward as you do that. And I want you to think about your tailbone stretching away from your pubic bone. Remember that diamond that we had, our pelvic basin? 4 bony points: the tailbone, the sitting bone, the pubic bone, the other sitting bone. As we round, we're going to think about those 4 points coming together. The tail's moving towards the pubic bone. The sitting bones are moving towards each other. This is a pelvis move more than an upper back move today. And then we're going to start to bloom that diamond out. Think of your sitting bones. You're like prying the sitting bones apart from each other. They're not really moving that much if we were measuring them, but there's a tension change. It's pretty significant. And then we bring the points together. Let's increase that by using breath. We'll breathe in through our nose, expanding the belly as we lift our tail and expand the pelvic belly into that diamond space. Keep breathing in. And you breathe out through the nose, the belly condenses and the pelvic belly condenses. Now you're sucking that smoothie again, pulling up. Relax the anus, breathing through the nose. Breathing in, expand the belly, expand the pelvic diamond. Breathing out, condense the belly. Condense up from the pelvis. So subtle. Inhale, expand. And it's different than Kegels. Like we all kind of learned about Kegels, I feel like, which is one thing, but don't feel like you have to squeeze. I don't want you feeling like you're actively like, now I flex. Just do the breathing and move the skeleton and let the flexing happen. Sort of like you get out of the way more than anything. Now let's go flat back, tuck your toes. Heels are reaching back, take a breath in. We're gonna exhale, we're gonna let our belly condense without changing our spine around, okay? So just let the belly lift, let the pelvic floor lift. When you feel condensed and contracted, we're gonna float the knees off. You can't even see, I lifted so little. So little. Spread out your hands, reach your heels back, breathe through your nose, and then put them down. Okay, watch that you don't lurch when you lift. And you might not even lift off the floor. That's okay too if it's just an effort. Deep breath in, deep breath out, connecting the belly, condensing the belly, condensing the pelvic floor. We lift up. The tail and head are long, reaching away from each other. Nobody's tucking. Long back, breathing, reaching heels back, down on the knees. Inhale, expand. Exhale, condense, keep your spine where it is. And then we're gonna float up with our condensed belly, which includes your condensed pelvic floor belly. Heels back and lower down. Nicely done. Let's just roll the wrists out a little. That can be kind of, wristy while you're getting used to it, learning how to connect in all those places. Lay down on your right side. I have my arm bent. You could choose bent or straight, whatever feels good. This is an option too with a pillow. Okay. Now my feet, they're not forward today. They're back in line with my tail. My head is also not forward. My head is back in line with my tail too. Start to open and close. And I want you to think about long inhale through your nose. As you open and close, maybe, 2 times, 5 times, however much you breathe. When you get to the top of your inhale, don't exhale right away. I want you to see if you could use your leg like a bike pump. You're gonna pull it up and get more air. And then you're gonna get more air. And then you're gonna get more air. And then when you must, you'll exhale out. Okay, when you're like, that's it, I got as much air as I'm gonna get. And then again, on your next inhale, you fill your whole body, you fill your whole back rib. And then we use this movement as a little gentle opener. Let it open the lung a little more, taking a tiny sip of air deeper each time you lift up beyond where you thought the end of your breath was. And then of course, exhale out. Just try one more breath wherever you are. You might not be timed up to my cues depending on your breath capacity. And then let's rest down for a moment. Just pull the knees in, tuck into like a little cozy ball. Feel this is your cat stretch again. Your tail's tucked, your head is tucked. Now I want you to go out into that neutral back, where your head and your tail are in a long line opposite of each other, which is different than an arched back. Okay, just neutral. You're gonna pick up your leg and go behind it. And I want you to find your sitting bone. That pointy bone, the end range of your bones before your pelvic floor starts. There's a lot of attachments along this space. Then take your hand a little further behind and feel your tailbone. Be aware of that spot. And then let's just stretch up the leg. Flex and point your foot a few times. And think about how your sitting bone is connected all the way to your heel when you flex. It's like a giant rubber band here. Come up to the ceiling with your foot. We're gonna go as slow as humanly possible. Softly flexing foot, slow. As you move, if your tail begins to tuck under, I want you to instead reach your tail to the wall behind you so that your sitting bone and your foot are pulling in opposition, or your tail and your foot, I should say. Stay here, press your hand gently. as you start to lift. Press your knee gently as you start to lift. Once you get about halfway, I want you to transition your mind back to your sitting bone. Can you think about this movement as a sitting bone opener more than a leg stretch? Keep opening your sitting bone when you get to the top. Stick your tail out a little bit to open your sitting bone more. Think about that pelvic diamond, stretching and stretching. Keep going leg, keep going leg, keep going leg. Yes, my quiver a little. Then we're going to go back down. We're just doing one more of those. We don't need to do too many. Softly flexing the heel. You might even have the tiniest bend in your knee. That's fine if you need that. Tail reaches back behind you. Feel the elastic stretch from your sitting bone through hamstring, through calf, through heel. Now, before you come up, press the floor, stretch your tail back. It's so small, but when you stretch your tail back, you're going to feel more connection to the floor underneath you. Slow it down, quiver, shake. That's fine. You see my foot's kind of moving. That's a good thing. We're playing with that. We get towards the top. You might think you're going to cramp, but just talk to your body, relax. And if you need to, take a minute if you're getting crampy. You get to the top of your move, you open your pelvic diamond more, reach your tail back, open your sitting bones more, and then bend down. Okay, that's getting both of your hips really working together, I hope. Hope you're feeling that. Let's go to the other side. And again, if you're crampy, that's okay. You're just not used to working that spot. It will reduce over time. Okay. All right, we start by getting out of this cozy position. You're going to bring your head back. You're going to bring your feet back in line with your tail. And then you'll start to move the legs. And you're going to start to breathe in. Long, slow, full breath through the nose. And when you think you're full, you're going to move this leg, your little bike pump, sucking more air in at the top, sucking more air in at the top, more air, tiny bit. And when you are just ready to burst your balloon of air, you exhale through the nose again. And then you come back when you're ready for another breath. Try one more breath. See if you can get more of these leg pumps. Keep going for it at the top. And when you've let all the air out, just curl up for a second. And then go back into your more long position. Don't stick out your rib cage. Okay, we have a tendency to do that. Pat those guys in a little. Pick up this leg, go behind it. Let's feel the sitting bone on this side. Just palpate all the way. You could almost feel under the sitting bone. That's your pelvic floor. And then go back and feel your tailbone. So we can remember that, guys. Stick your tailbone out into your finger a little bit so you feel how that happens. And then tuck your tail under and feel that. And stick it out a little. Okay, we're sticking it out a little, not the most you could ever possibly stick it out. You don't want to feel locked. Take a stretch. Flex your heel. Feel the sitting bone stretch into that heel. Point your toe. Flex your heel. Point your toe. Okay, we come up to vertical. And then slowly reaching your tail back as you start to lower down. Nice and slow. Really gently reaching the tail back so you feel that stretch through all the back of your leg. When you're ready to press up, push your hand, push your bottom knee. Just gently into the floor. Take your time, no rush. How slow can you go? How slow can you go? Shaking, quivering, all good things. And at some point, you're starting to think about your sitting bones now. You've forgotten your leg. Let's focus on the expansion of the two sitting bones. Let's expand the tailbone back behind us too. Keep moving leg, keep moving leg, keep moving leg. And then we come back down. Re-engage into your flexed foot, not a lock flex. It's just flexed enough to, it's a B student. It's doing it good, doing a good job, but not crazy good. Gotta watch out for those A students. Okay, stick your tail out behind you. Press down in your hand, press down in your bottom knee, slow it down, slow it down. Shaky, shaky's good. Start to transition your brain into your pelvis. Open your sitting bones, open that top sitting bone, reach your tail back. It's almost like the feeling that you get when you're taking a squat, that reaching of the tail back. Keep going leg, keep going leg, keep going sitting bones and pelvis. And then we bend down, okay? Give it a little rub. We're gonna come up to standing. Okay, let's come up. I mean, ideally, here we are in this class. If you're able to squat, you come up from a squat. Now, if squatting is not your friend, you're gonna be doing some of these squats with something underneath you, whether it be a chair or a couch or just like a yoga block on the ground. But I'll demo that in a moment. First, we're gonna have heels together, toes apart. 10 and 2 with the toes, not 3 and 9. Let's open the knees slightly. And when you're opening the knees, it's just because we're actually opening the tail and pubic bone. We're actually opening the 2 sitting bones. We're gonna stand, but first I want you to spread out your toes. Press through the ball of your foot. Feel the spiraling up through the inside of your body rather than the knees pushing. Okay, so think about that as you open. It's a pelvic floor prying open. Okay, the knees bend to allow that. And then as you stand, it's a press more through the foot than the knee. Ball of the foot. Spread into it. And again, we bend. We open the pelvic floor. Inhale, expand. Exhale. Condense. Inhale, expand. Exhale, condense through the nose. Inhale, expand, spread your toes. Exhale, condense. Now for the squat, get something that you can land on. I'm going to use this demo of this. So this is about as high as a footstool. Some of us might just need a footstool. Some of us might not need anything. It doesn't, just where you are, be there. So you're going to take your legs kind of wide and you're going to go down. And so like for me, I'm going to land on this right now to show the prop. And maybe you're in a chair and you land here. But when you come up, press through the whole foot the way you just did on those pliés. Okay, so it doesn't really matter where you go, just so long as you are reaching your butt behind you. You're opening the pelvic floor, and as you stand, you press through your whole foot as soon as you can. So for those of us that are going all the way to the floor, the heel has to lift for most of us. Some of us have really stretchy heels, but like my heels lift, right? So when I'm standing up, I'm gonna press through my heels as like a first response. Okay, and you can get just as much if your knees aren't into the deep bend right now yet today. Here's me sitting on a couch in a squat, right? And then I'm gonna come back up, which is different than sitting on the couch, right? So just do what you need to do where you are and be conscious of it. One more time. Breathing deep through the nose. So our heart rate's gonna get up now. It's gonna be harder to breathe through the nose if that's not something you're used to doing, but just stay with me if you can. Okay, we're gonna have legs apart a little. Bounce, stand. Okay, simple. We're gonna start dancing soon. Okay, now we're gonna add a leg lift. So just lift a leg, bounce. Lift a leg, bounce. Flex your foot just a little as you lift your leg. And think about this like you did your side legs. This is a sitting bone open, a sitting bone open, sitting bone, expanding the pelvic diamond, expanding, expanding. One more each side. We're going to change it up. I don't know why I have to face backwards for this. We're going to put your right leg out and your right arm comes down towards your left foot. And then you're going to come up, you're going to switch. So we're doing a diagonal switch, switch. And you can go at whatever pace you need to go. If you're like, I got to go a little slow and maybe you're just holding the knee, that's fine. Or maybe you're like ready to really jump into it. If you're wearing socks, you could slide as well. Slide feels really good on the pelvic floor too. So find some variation of this right now that's making your heart pump, and breathe through your nose. Look forward as you reach, not down. Forward, long spine, lifted tail. Right when we look down, the tail is tucked, tucked. You want to stretch it, stretch it. One more each side. And then come up to sitting or standing, mouth stays closed. Feel the expansion happening and condensing happening before we go into our final movement. Tippy toe on one leg. Rotate the knee in and out. In, out. We're not moving the whole body. Okay. We're trying to be mostly still up here. And we go in and out with the leg. Put that leg down, other side, tippy toe. Rotate. Rotate. That knee is bent. Sort of like you're polishing the inside of your hip cap, the inside of that ball and socket joint. And in a way you are, because this movement is signaling your body to send some blood, send some joint fluid. Okay, now legs are a little apart from each other. Bend them. Take your arms out. Tailbone is sticking out. Then we've moved the hands in, the knees in, out, in, out, in. Okay, this is phase one. This is wonderful. But even better for the pelvic floor is if you can kind of put some flow into it. Could you make it round, more like a figure eight? And my pelvis, right, is going in and out with this. My spine's moving too. So we've just incorporated the spine and pelvis, not just the knee and arm. Flow it in, out. This is a Tootsie Roll. Let me see your Tootsie Roll. Can't help it. Say that. One more in and out. Keep going with that nose. Breathing, and then stay here. We'll finish with a stretch, hands behind the head. Legs are hip width. I want you to move your pelvis in a circle, but try not to move your shoulders. Okay, don't go like this. Okay, how much can you move without moving the upper body? It might be small. Okay, if you're not moving the shoulders, you might be doing such a small move that I can't even see it, but you know you're moving. And then as you get a little more confident, you go bigger. Let's reverse it. This is my dance music I got going in the club. I just bring sound bowls whenever I'm at the club. One more circle around. And then look up to the sky, reach your palms up, reach your heart up, expand your armpits, expand your belly, and then slowly stretch down to your sides, taking up all the space in the room that you can. And that's it for today. Nice work. Thank you for joining. If you have the space in your schedule, take a 10-minute walk after this class. It will really set what we've done into your gait. Okay, take care. Till I see you next time.